Hi, and today we'll be discussing the topic autoimmune diseases in immunology. The topic we are going to discuss is about the systemic diseases and the organ-specific diseases. So, in autoimmune diseases, it's diseases in which the immune system actually, instead of helping the individual, it starts misidentification of its own tissues and start destroying them. So it's the self-tolerance mechanism that normally help an individual to distinguish between self and non-self components fail here, and the body's immune system fights against its own tissues, causing different kinds of diseases. What are the causes of this disease? And mainly, there are many causes. Some may be due to heredity, environmental factors, and some may be due to the diet or infections by pathogens. First, we are going to discuss about is Hashimoto's thyroiditis. It is a well-studied organ-specific autoimmune disease in which the thyroid is getting actually destroyed by the body's immune system. It leads to hypothyroidism and goiter. It was first discovered in 1912 by Hikaru Hashimoto. The occurrence of that is Hashimoto's disease is higher in countries where there is excess iodine in their diet. It mostly affects middle-aged women than men. The cause of the disease is that the thyroid gland actually produces the thyroid 2 proteins, that is thyroglobulin and thyroperoxidase. They are involved in the uptake of iodine. In thyroiditis patients, these antibodies or autoantibodies are produced against these proteins. Binding of autoantibodies on these proteins will affect the iodine intake that will lead to decreased production of thyroid hormones T3 and T4. The symptoms of this disease include hair loss, fatigue, depression, weight gain, intolerance to cold, muscle cramps, goiter, cardiac problem, delayed reflex action. The treatment is that is mostly done with the help of synthetic thyroxine, that is L-thyroxine. Next one is Graves' disease. Graves' disease is an autoimmune disease in which autoantibodies are produced against thyroid stimulating hormone receptors, which lead to hyperthyroidism. It was first discovered by or described by Robert Graves. Graves' disease is more common in women than men. It is an autoimmune disorder. Other factors like genetics and environmental factor also contribute to it. Causes of the disease include production of thyroid hormone, which are under the specific of thyroid stimulating hormone secreted by the pituitary glands. There is over stimulation of thyroid gland. Here, autoantibody is produced again are produced, and this interact with the thyroid stimulating hormone receptors, leading to overstimulation of the thyroid gland. Overstimulation leads to hypersecretion of thyroid hormones, the symptoms of which include exophthalmic goiter, that is the protruding eyes and the bulging of the that is thyroid gland. Then there will be tremors, then there will be dermopathy, that is affecting the skin, then tachycardia or increase in heartbeat, heat intolerance, weight loss, increased deep tendon reflexes, weakness in muscle atrophy, increased cardiac output, myasthenia gravis, thin hair, warm moist skin, sensitivity to light, dysphasia, that is problem in speech, diarrhea, amenorrhea, polyuria, etc. The treatment is done with the help of antithyroid drugs. inorganic iodide treatment, radioiodide therapy, which is most commonly used. This is a differentiation between hypothyroidism and hyperthyroidism. Here there is weight gain, weight loss, then there is goiter in both cases, there will be hair loss. In this case, there will be bulging eyes, yeah, there will be puffiness of the face, the heartbeat will be slow, weight gain will be there, constipation will be there, it leads to infertility. Myasthenia gravis. It's an autoimmune condition. It causes muscle weakness. It worsens with that is activity and improves with rest. The cause of the disease is that the motor neurons that normally communicate with the muscle through a junction called neuromuscular junction. During impulse transmission, the axon of the neuron produce neurotransmitter acetylcholine. This will pass through the synapse and it will reach the other muscle and it will bind to the acetylcholine receptors normally. But when in myasthenia gravis, acetylcholine antibodies produced by the immune system will go and bind to the acetylcholine receptors and block acetylcholine binding. This leads to problems in muscle contraction. So they will actively complement that is, it will also activate the complement system in the neuromuscular junction, which leads to damage of the cells in the postsynaptic membrane also. So the symptoms of the disease is the drooping eyelids, weakness of arms and legs, change in voice, and difficulty in swallowing. Medications can that is to increase amount of acetylcholine at the junctions help in minimizing the symptoms. Immunosuppressive drugs called containing glucocorticoids and non-steroidal immunosuppressive agents help in treatment of the defect in immune dysregulation. Plasma exchange therapy and intravenous immunoglobulin injections are very good in handling this disease. Next is systemic lupus disease, which is affecting multiple organs, which leads to that is disease affecting the skin. It is the skin rashes which appear as wolf bites. Then it is a autoimmune disease. That is here the immune system of the individual mistakenly attacks the healthy tissue of the body, damages the skin, joints, kidney, brain, etc. It is common in females than in men. The butterfly-shaped rashes on the skin, fatigue, sensitivity to sunlight, loss of appetite, joint pain and swelling, hair loss are the common symptoms. The cause of systemic lupus erythematosus is not known. Some factors include genetic diseases, genetic factors, environmental factors, hormonal, certain medication can also trigger this disease. Then autoantibodies will interact with the tissue antigen and produce various symptoms called as known as skin rashes, will cause symptoms such as skin rash, thrombocytopenia, anemia, etc. So this can be controlled by the use of anti-inflammatory drugs for joint pain, stiffness, steroid creams for rashes, administration of corticosteroid to reduce the immune response, administration of anti-malarial drugs for the skin and joint problem. Disease-modifying drugs are targeted immune system agents for severe cases. Apart from that, there is another disease called as that is multiple sclerosis. It's an autoimmune disease that affects the central nervous system and causes neurological disability. Here, the individuals ഇവിടെ ഉണ്ടാകുന്ന മൈലിൻ ഷീത്തിൽ വരുന്ന ഡാമേജ് ആണ് നെർവ്സിൽ കവർ ചെയ്യുന്ന മൈലിൻ ഷീത്തിൽ ലീഷൻസ് ഉണ്ടാവുകയും അവിടെയൊക്കെ T-സെല്ല് പോയി അവിടെ അറ്റാക്ക് ചെയ്ത് അവിടെ ഓട്ടോ ആക്ടിവേറ്റഡ് ആയിട്ടുള്ള T-സെൽ ഇറ്റ് സ്റ്റാർട്ട് ഡിസ്ട്രോയിങ് ദ മൈലിൻ ഷീത്ത്. This will lead to various kinds of neurological disorders. It will cause pressure on the souls. Then it will have problems in contraction. It will also lead to osteoporosis. പിന്നെയുള്ളൊരു വളരെ ഇമ്പോർട്ടന്റ് ആയിട്ടുള്ള ഒരു സിസ്റ്റമിക് ഡിസീസ് എന്ന് പറയുന്നത് റുമറ്റോയിഡ് ആർത്രൈറ്റിസ് ആണ്. ഇറ്റ്സ് എ സിസ്റ്റമിക് autoimmune disease affecting women than men. Here the common symptom is inflammation of the joints and painful joints, and will also lead to cardiovascular, hematological, respiratory systems defects in that. And affected individuals will produce auto antibodies that will here the factor is IgM antibody, which will go and react with IgG, forming a complex and deposit in the joints. This will activate the complement reaction and lead to type 3 hypersensitivity reaction and chronic inflammation of the joints. In rheumatic fever, the streptococcus infections will cause antibodies will be generated. This will cross react with the heart muscle antigen, leading to damage and rheumatic fever. So this is some of the autoimmune diseases that we had studied, and the ones which included were the rheumatoid arthritis, multiple sclerosis, then myasthenia gravis, lupus, then there was Hashimoto's thyroiditis and Graves' disease.